So now we'll look at the actual stem cell transplant process. So this actually involves a person coming into hospital for high-dose chemotherapy. Now, there's lots of different treatment protocols that can be given. So just like standard treatment, there's all different treatment protocols that are available for a doctor to choose from. The same is the case for transplant. And certainly the treatment that is given for someone who's got myeloma or amyloidosis compared to lymphoma is vastly different. So the treatment can actually be on one day, which is usually the case for myeloma, which is just melphalan. It's one drug and it's given on one day, and occasionally it's split and given over 2 days. Or for lymphoma, the treatment can actually run over sort of 5 to 6 days, and then finally have a rest day and have your stem cells reinfused 24 hours later. So there is usually a period between the chemotherapy being completed and the stem cells being reinfused. And so that can be anywhere from 24 hours up to 48 hours. And I think there is one protocol where it can be sort of 3 days before those stem cells are actually reinfused back to the patient. The reason for that is we need to make sure that chemotherapy is cleared from the system and that it's not going to cause any damage to those stem cells that we reinfuse, because we want them to go straight back to the bone marrow and re-engraft. So once we've had the chemotherapy given and we've had that rest period, we actually have the stem cells being reinfused. And we normally call that day 0. So we count the chemotherapy days in a negative phase. The transplant or the reinfusion is called day 0. And then we count in positive numbers post the transplant so that we know exactly where a person is along that treatment process. So the stem cells are actually stored in a big freezer such as this until the day of transplant. And then once that transplant is known, the clinical ward or the clinical team will usually talk with the laboratory staff to identify an actual reinfusion time. So a couple hours before that reinfusion is we transferred out of the tank and actually put into a small dry shipper. So that actually starts thawing the stem cells for when it comes across to the bedside. So then you have the person arriving at the bedside, and we actually have a water bath, a machine or its equipment that actually warms up the water to 37 degrees. So it's just like a nice warm bath. The stem cells are actually, they're sort of been put into a secondary bag to make sure that they don't split or rupture when they've been stored in the tank. And we also put them in an additional plastic bag, just like a drawstring plastic bag, for when we actually put them in the water to thaw. So that if anything happens to those stem cells as they're thawing, we still have the ability to reinfuse those back to the patient and they're not just going to be dispersed into the water. Now that doesn't happen very often. We did have bags many years ago that were very brittle and they used to actually rupture or crack in the freezing process, so that when we thawed they would actually leak, and that's why we have these secondary bags here so that we can actually capture and draw them up. But in my last 10 years of doing transplant, I hadn't seen any split or fractured bags. So it's a theory, it's a risk, but we need to make sure that you've had chemotherapy. So we need to make sure that that chemotherapy goes back to the person that that's had that. So the stem cells are just given back like a red blood cell transfusion or a platelet transfusion. So the nurse is actually in the room. We do the checking process and then we spike and hang the bag. And usually with the newer machines that we've got, we usually end up with a volume that's probably sitting at about 70 to 90 mils in a bag. And usually people will get 1 or 2 bags back at the most. If someone's had a lot of stem cell collections, then usually that might mean that there's more bags to actually reinfuse back to make up that total of 3 million stem cells to give back in a transplant. But as I said, usually it's 1 or 2 bags, and that usually takes about 20 minutes per bag to reinfuse. And what we actually do, you can actually see that there's a sort of a Y connection here to a bag of saline. So we want to make sure that everyone gets all of those stem cells back. So we actually rinse the bag 2 or 3 times until we actually get a clear fluid product sitting in that bag. And that way we know that as many stem cells that are sitting in that bag have been reinfused to the patient, and then we're not leaving anything behind. The other thing that we also do is that we actually take, right at the end, we actually take all the fluid out of the line. So we usually have like a 3-way tap system where we put on a syringe and we'll actually suck down everything down that line to make sure that a person is given absolutely everything back that has been sitting in that line and in those bags. Now, usually on that transplant day, it's a bit of a, what's the word I'm trying to think of? It's a bit of an anticlimax emotionally. So a lot of people have gone through a lot of treatment. They are really quite anxious about the high-dose chemotherapy. It can make them quite sick, and we'll talk about side effects in a minute. But when it gets to that transplant day, there's a lot of anxiousness, stress about it. We usually actually give a person a pre-med, so they do actually become quite sleepy. And quite often a person actually ends up sleeping through the transplant process, so that when we're sort of fiddling and taking lines down, a person usually wakes up and they go, oh, we finished. And it's like, yep, it's all done. So it becomes a bit of an anticlimax. People, it's like, oh, is that all it was, sort of thing. And it's nowhere near as stressful as actually going through the key treatment or actually going through the actual collection of the stem cells to have them stored away. But there's a couple of key things that we need to remember. Number one is we need to maintain some sort of activity, so we need to keep doing all the things that we need to do, even if it's just in small bursts. And we also need to maintain our mouth care, our hygiene, and looking after ourselves when you're going through that transplant. And that is there. So then immediately after those stem cells are reinfused, it's actually within a couple of hours that we'll actually have those stem cells have left the peripheral blood and they've actually gone straight to the bone marrow. So they know exactly where they need to go. So they've headed out, they're in the bone marrow, and they start to divide and grow. But it actually takes about 10 to 14 days from the time of the stem cells being reinfused before we'll actually see the blood cells that we see in our peripheral blood start to come back and regrow from those stem cells that have been reinfused. Once we see those stem cells return to the peripheral blood, that's when we know that we've got engraftment, and the doctors are happy with the quality of the stem cells that have been reinfused. Now, very occasionally we can run into trouble where the stem cells that have been reinfused, for whatever reason, don't actually engraft and grow. Now, that is something that probably occurs, I've seen it maybe happen once every 2 years, where we've actually reinfused a number of stem cells, and no matter what, we don't see any counts come back in the peripheral blood. In all of those settings, we've always had extra stem cells in the tank, so we've actually been able to get those out and thaw them, and those people have eventually gotten their stem cells and they've engrafted, but we don't know why that first lot of stem cells has not engrafted. We do checks on the stem cells and the quality to make sure that in the thawing process that we have got something to reinfuse, but very occasionally even that can fall down and the bag that we give back just does not have stem cells that actually engraft and grow. So it's always a waiting period to make sure that occurs. So what actually happens with a stem cell transplant is the key thing around why we're doing this is that we're giving that high-dose chemotherapy to kill off any remaining disease that might be there in the body. So our technology of x-rays and blood tests and scans can't actually detect down to that one cell that might be left floating around our body. And it's that one cell that can get left behind that can actually eventually cause a relapse to occur. So that's why we're giving this high-dose chemotherapy. The doctors might be saying your disease is in remission, the scans are all clear, our bone marrow is fine, the myeloma protein test is recording 0, but we know from history of looking after people that there could still just be one cell left behind, which is going to cause that disease to relapse. So that's what that high dose chemotherapy is doing. It's going through and killing off that last remaining cell. But in doing that, it's also killing off good healthy cells. And it's those stem cells in our bone marrow that grow all of our blood cells. Because they're rapidly dividing, they get affected by the high dose chemotherapy quite significantly. So hence the rescuing with the stem cells that have been collected.